Hey, what's up? Dr. Allen here. Today we are reviewing Lipiflow treatment, the in-office dry eye treatment, specifically for dry eye syndrome and Meibomian Gland Dysfunction. And one of the major reasons we are talking about Lipiflow here today is because it is one of the most commonly found and offered dry eye treatments through your local eye doctor's office. And in this review, we're going to cover things like what is it, how does Lipiflow work, and then answering common questions that both my patients and viewers often ask, such as what is the cost, is Lipiflow covered by insurance, and when is Lipiflow worth it? Because believe it or not, there are times when I do not recommend Lipiflow for my patients. And this will all come from both my objective and subjective experience, both as a patient of the procedure, as well as a doctor performing it for my patients in the clinic. And I love covering topics like this, so hit that like button for me if you enjoy these sort of honest and in-depth reviews. So the Lipiflow treatment was specifically designed to treat the most common form of dry eye disease, known as evaporative dry eye. That means, once again, we're going to be talking about Meibomian Gland Dysfunction, also known as MGD. We all start with about 60 Meibomian glands on each eye, and whether it be due to hormones, diet, environmental factors, skin conditions, and lifestyle factors like computer use, these glands can eventually get clogged up, become inflamed, and even potentially die off. And if you're either not making enough oils or the oils you're making are of very poor quality, then your tear film ends up evaporating very quickly, which leads to an increase in salt content and loss of homeostasis and balance of your tear film. Historically, treatment for Meibomian gland dysfunction has always included doing things like warm compresses, and this is something that many people do at home, but the heat is supposed to act to melt the thickened oils within those eyelids, and then that allows the oils to run smooth and allow for decreased evaporation of that tear film. At least fundamentally, that's how Lipiflow works, except it's been specifically designed to heat the temperature of the eyelids to the precise temperature of where the oils begin to melt in those oil glands. And then Lipiflow has a pumping mechanism which will squeeze both eyelids from both directions, and that helps express the oils within the oil glands, doing a full Meibomian gland expression. That way the old thickened meibum, or oils that are trapped in those glands, get melted, and then they get expressed from those Meibomian glands, allowing for new oils to be made and released upon each blink. And many studies have shown that Lipiflow can not only decrease the inflammatory load on the surface of the eye, but increase your T-BUT, or tear breakup time, essentially decreasing the evaporation, as well as improve your OSDI scores, which stands for Ocular Surface Disease Index scores. So again, at heart, the whole goal of Lipiflow is to heat those thickened oils, get them to express so that your eyelids are able to make new oils to prevent your tear from evaporating, therefore improving your dry eye symptoms and preventing Meibomian gland dysfunction from eventually causing death of those oil glands to the point where you can't get them restored. So it's as much of a dry eye treatment to improve your symptoms as it is a preventative measure to prevent those oil glands from dying off. In contrast to things like warm compresses, although warm compresses can help people with really mild dry eye symptoms, the clinical benefit of warm compresses is minimal at best, and they are pretty time-consuming. And to be fully honest, most people just don't do them, or they just don't do them on a regular basis. Let me know in the comment section if you've ever tried warm compresses and if you actually do them. You see, Lipiflow is kind of like having 180 warm compress treatments done all at one time. I got that number because at least one published study found pretty similar results of a single Lipiflow treatment to doing about warm compresses twice a day, every day for 3 months. Except that because of the way Lipiflow works, it may in fact be safer as well as more efficient at treating Meibomian gland dysfunction and dry eye than using warm compresses. Now, the whole experience of having Lipiflow done is honestly pretty comfortable and is sort of like having a full spa treatment for your dry eyes. And a huge thank you and shout out to our student, Dr. Monica, who volunteered to sit as our patient for this video demonstration. Assuming that your doctor has already determined that you are a good candidate for the Lipiflow procedure, the first step is that your doctor will put some numbing eye drops into the eyes just to make the eyes more comfortable. Then the Lipiflow device comes with these little eye devices. They're almost like little eye cups. These are then inserted behind the eyelids, both top and bottom, and this cup provides both a safety mechanism to protect the cornea, as well as provide direct heat to the inner sides of both eyelids. And this is really important because not only does it provide heat directly to the eyelids, but it prevents the eyeball from getting heated up and prevents any excess pressure from being pushed onto the eye. As too much pressure on the cornea from a warm compress can not only warp the cornea temporarily, but may potentially be an issue for people who have glaucoma or a condition called keratoconus. I'm not aware of any studies specifically looking into warm compresses and the effect on those conditions, but I know in our profession there is some concern over that. And at least with Lipiflow, we know that that's not really a concern. But the whole Lipiflow procedure only lasts about 12 minutes. That includes both the heating of the eyelids to the precise temperature of the melting of the glands, as well as the Meibomian gland expression that occurs. And really after that, you're all done, unless your doctor chooses to evaluate the oil glands behind the slit lamp afterward, just to manually express any oil glands that maybe need just a little bit more expression. Now, as far as Lipiflow cost, typically the prices I've seen for Lipiflow go from anywhere from the $700 range up to about the $1,500 range. But that'll largely depend on the location as well as the cost of running the procedure at your doctor's office. They say that because when you have this procedure done, the individual eye cups, they actually cost money to run those cups individually. So when your doctor purchases the Lipiflow device, not only do they have to buy the instrument itself, but then they have to buy those individual eye cups every single time that you run the procedure, because the eye cups have been programmed to only use once and then they self-terminate, which really falls into a whole other topic of frustration I have with modern medicine, but we'll save that for another video. But as the price of these individual Lipiflow heads goes down, then so will the overall price for this procedure. Now, some of you may be asking, is Lipiflow covered by insurance? And the answer is yes and no. Technically, there is a procedural code for it. However, most insurances do not accept it, and it also depends on the location of which you live. So for most people, it is going to be cash pay. So is Lipiflow worth it? For most people, I would say yes. In fact, I would say for most of the people that come into the clinic, I wish I could just run this on just about everyone. And the reason I say that is because it has a great preventative utility, and we just know that with everyone's lifestyles being on the computer these days, most people would benefit from having it done at least once. And studies do show that even just after one treatment, it can have long-lasting effects up to 1, 2, 3+ years. With most people who have dry eye syndrome benefiting from at least one procedure done a year, and some people with bad Meibomian gland dysfunction needing it probably more often. But there are times when I don't recommend having Lipiflow done. That is either one, somebody comes in and they don't have any problems with Meibomian gland dysfunction, which is pretty rare, or two, they have such extreme forms of Meibomian gland dysfunction that, in fact, they don't have any Meibomian glands left. They've completely atrophied. Because at that point, if you don't have any glands left, there's really no point to having the procedure done. Now, because of the success of Lipiflow, there are several other companies that are coming out with similar designs, such as the iLux, for example, which we've actually covered on this channel. If you want to check out that video of the iLux device, I'll put a YouTube card link up here up above, as well as in the video description below, so you can check that out if you want. But at least one published study, which I'll try to put a link to below as well, that did compare Lipiflow versus iLux and found the results to be very comparable. And speaking from at least my experience having it done, as well as the feedback I get from my patients, when you have the procedure done, it's very comfortable. Again, doesn't hurt at all. And almost everybody I've ever done it on reports that their eyes do feel better afterward. The first day or two, things may be a little bit more gritty and rough. And at least the reason I think that is because you remove all these oils from your glands, and these oils have a lot of inflammatory proteins in them. And so you kind of get this rebound inflammation on the surface, as well as you're not your glands don't have much oils in them anymore afterward. So when you're blinking the first few days, you're maybe not getting as much oil on them. But I know after 3-4+ days beyond that, most of my patients, including myself, noticed dramatic improvements in our symptoms. But be sure to let me know in the comments what your thoughts are on Lipiflow. Have you had it done yourself? And would it be something that you would consider getting? Either way, thanks for watching. Keep an eye on it, and we'll talk to you soon.